The Local Show, sponsored by Victory in Motion, home of knee repair, not knee replacement, on News Radio 570 WSYR, on 106.9 FM, and live everywhere on the iHeartRadio app. The Local Show features in-depth conversation with business owners, employees, and influential business leaders throughout Central New York, exploring their successes, challenges, and reasons for doing business right here in our growing community. The Local Show is produced locally by Zoe Advertising. Now your hosts, Tom and Steve.
We are back into it and back at it. It's The Local Show with Tom and Steve. Easter weekend. Hope you're having some fun with family. And I don't know if it's really warm enough to do Easter egg hunts and things like that.
Sure,
well,
yeah.
The kids don't care.
You know what? It's
kids
right.
don't
I mean,
care.
earlier this week it was nasty, but it's. I was looking at the 10-day. It's warming up. It almost looks fishable here.
Yeah.
In the next week. So somewhere,
You'll
if I stop
do that,
working,
right.
I'll go.
Is there any fish on the lake at this point, other than perch and
Well,
stuff?
May 1st is walleye.
Right.
Will open up.
Is
Perch,
it May 1st?
crappies.
I thought it was the third Saturday.
That's bass season.
Oh, bass. Okay.
Yeah, it used to be the first Saturday in May. They made it May 1st.
Yeah.
But the third Saturday in June.
When's the big walleye tournament again?
That weekend, that first weekend.
Oh, okay.
Matt, our friend, the
Gutchess,
Matt Gutchess, the tournament up there,
Yeah.
Walleye Fest. So, hey,
Right.
by the way, if you're a fisherman, the prices are great. It's a great community event.
Absolutely.
I know you can. We should get him over here and him talking about
Have
that
him
again.
talk about it again. He's a really
But
colorful
Easter's
person.
here, and I like, you know me, I love Easter.
Yeah,
It's
excellent.
new beginnings and new life.
Absolutely.
Love it.
All right, Dr. Marc Pietropaoli is with us right now. He's the owner of Victory in Motion, home of knee repair, not knee replacement, and he has a patient with him, Sam Prine. How you guys doing?
Great. Thanks for having us.
It's good to see both of you, and nice to meet you for the first time.
Likewise.
There, Sam. So, Dr. Pietropaoli, how's things been going?
Things have been going great.
Yeah. So, have you taken on new patients? Are you still accepting new patients?
Every day.
Really?
Every day. Sure. Every day.
You don't get because we thought by now, being associated with this show, you'd have so many patients.
Callers are standing by.
We do get people who call in because of the show, so thank you for that. And
good.
maybe Sam can even talk to that.
Yeah, that's absolutely.
But people are in pain. And, it feels like, Tom, everybody our age either has had a knee replacement, they're talking about a knee replacement. They tell us we carry too much weight, and they tell us, doctors,
Three people at the gym I've told about Dr. Pietropaoli. Yeah, 3 people.
Yeah.
Well, because, I see that they're in pain and then they got their knee wrapped and the shoulders,
Right.
and I'll say, You're hurting over there. What do you think? Well, I'm due for a knee replacement. I go, you really got to talk with Dr. Pietropaoli out in Skinny. I've heard of that. Tell me a little bit more. Well, I can only go so far, right? Because I'm not a doctor. So the thing that I can't articulate is what? What do you do? Tell people about that.
Well, we use the patient's own healing factors within their blood and within their bones and within their body to help them heal themselves so that they can avoid metal, plastic, and cement from a knee replacement, for instance, since you're talking about that.
Yes.
And we use other methods to help them get healthier. So some people will choose to undergo genetic testing, so we can figure out what the best diet is for them based on their genetics. Some people say, I need to be carnivore, I need to be vegan, I need to be, I need to be Mediterranean diet. Well, really, you don't really know until you get your genetics tested.
So wait a minute. So Mr. Carnivore Tom over here.
Yeah.
Okay, major carnivore. Are you suggesting that maybe if Tom got testing, he should eat nothing but tofu? Is that what you're saying?
Yeah, we don't know till you really know.
There's that big a difference in what people's bodies need?
We've absolutely seen that, yeah. Not everybody, but we've definitely seen it. Most people, sure, yeah. They think they need one thing, and it's actually something different.
Right. And just to be clear, not only will you take care of the knee, but you could do the same thing for shoulders.
Correct.
That's a big issue, too.
Absolutely.
Yeah, I know some people that are, they've been told they have to get both shoulders, taken care of, and that is something else that holds you up for a long time.
Well, look at a knee replacement, Tom. Knee replacement.
True. Yeah,
you got it. It's like 6 months, right? By the time they do it, by the time you get back into the groove, plus you have the risks of surgery and things like that. With regenerative things that you do, how is the process different, and how long does it take?
Well, I think like what you're saying is it can take 4 to 6 months to get back to quote unquote full duty activities after a knee replacement, but it can still improve or take a year, even 2 years to fully recover from a knee replacement as long as everything goes well. I mean, 30 or 40% of people who get knee replacements still have some pain, and about 15% of knee replacements, fail or don't do well. So there's always those risks. There's obviously other bigger surgical risks and things like that. And I am a surgeon, and I obviously perform surgery. So there's always risk there, but there's a lot less risk of just taking your own bone marrow cells or your own blood with a needle and harvesting that and then concentrating it and injecting it into the areas that need to heal. And so that's a lot less risky, a lot less risk of infection, wound healing problems, and it's a quicker recovery. There's still some recovery, and depending on each person's different, so some people might recover a little faster than others, but in general, our programs are about a 12-week program. But we can talk to Sam about how much the downtime is. I've actually been through it for my elbow. So for me, I can speak to myself. Yes. I had my bone marrow harvested. I had the blood harvested. We concentrated it. My physician assistant, Jordan Reynolds, I trained him to do the procedure, so he did it on me and injected into my elbow. For 3 days, it was pretty sore because we're kind of restarting the healing process. We're letting your body heal itself. And after 3 days, it started to feel really good. By 2 weeks, it was feeling really good. And I think I was probably overdoing it, which is a tendency that sometimes we do. But by 6 weeks, I was about 50 to 90, 50, 60% better. And by 12 weeks, I was 95% better. And almost a year out, I'm 100% better.
Wow.
So, but you have to be all in. You have to kind of go through all the different components, which includes total body fitness and things like that.
Do people doubt that you can help? Like, well, my doctors, they told me I need a knee replacement, so I know that's going to happen. I know you say you can help, but do they look at it as almost like voodoo medicine, or that's not real? Or do you have are there walls there because people are used to traditional solutions?
Definitely, but I mean, there's a lot of people have heard of stem cells nowadays, so people come a lot of times asking about those. But yeah, of course, there's even if I'm going to do surgery on someone, sometimes people it's normal to have some doubts or some concerns or some fears or some trepidations. It's pretty normal. But we're finding that less and less. But yeah, absolutely. They're like, wait a minute, I was told I needed a knee replacement and I have bone-on-bone arthritis. And then we get x-rays and it's like, well, you don't really have bone-on-bone arthritis. And actually, the problem is the bone is getting soft underneath the cartilage that's wearing down, and we can actually try to get that to heal, and most of the time we can get that to heal and prevent you from needing a knee replacement.
So they might have had a misdiagnosis just to begin with. They have pain,
or even more likely a non-diagnosis. Like, you don't really know if someone has that stress or microfracturing, those soft spots in the bone, if you don't get an MRI. And a lot of people think, oh, you don't need an MRI because you have arthritis, and we can see it on x-rays. But the pain from the arthritis comes from the bone. It doesn't come from the cartilage that's wearing down. So the tread wears down on the tire, the articular cartilage, the cartilage on the end of the bone looks kind of like the white on the end of a chicken bone. Yeah. That wears down. That's what arthritis is. But then the bone starts to break down underneath it, and that's what gives you the pain. And that's the part we can definitely repair.
Wonderful.
Okay, so hey, after the break, let's chat with
Sam Prine. Now we got the setup, and we
got it here. So we're just talking with Marc Pietropaoli from the Victory in Motion. If you have a question on your knees or anything like that, joint pain, that they can help. 685-7544. victoryinmotion.com, and when we come back around, we'll chat some more, and we'll examine the patient, and we'll ask some hard questions.